So what you're going to do is if you find somebody that appears to be unconscious, how do we know if somebody's unconscious? We're going to tap and shout, try to wake them up. If they don't respond, you're going to immediately call 911. Remember, giving Narcan doesn't substitute calling 911. So 911 is always the most important thing. So this is indicated in individuals that either have the potential for an intentional opiate intoxication or an unintentional opiate intoxication. That could be as easy as somebody using an illicit substance, or as easy as somebody, a small child, accidentally picking up a pill. That could be like a Percocet, Oxycontin, or morphine, and get it in their mouth. It'll cause them to stop breathing. So again, you tap and shout, try to wake them up. If they don't respond, you call 911. After that, if you believe they may intentionally or accidentally get exposed to an opiate, you're going to take your Narcan kit out. Inside the box is 2 doses of Narcan. You're going to remove the first dose out of the first package, place it in the Nair, and just click the button. That's all you have to do. If they don't start breathing right away, you're going to provide 2 minutes of CPR. Push hard, push fast, full recoil. After 2 minutes, if they haven't started breathing, you're going to take the next of the 2 doses, place it in the opposite Nair, and click the button. Continue CPR until EMS or PD gets there. There's no negative to Narcan. You can't hurt somebody with Narcan. If you gave this to me 3 or 4 times, it wouldn't have any effect. Maybe a little fast heart rate, maybe a little bit of jitteriness, no severe negative reaction. But if it does take effect, there is a huge negative to Narcan. And that's what we don't talk about enough. If you give Narcan to somebody and they wake up, they believe and the surrounding people believe they're completely sober. It's nothing further than the truth. This drug only works for 30 to 90 minutes. After that, they may re-intoxicate. So the reason that we come out here to the street fairs is where we reach a much larger population. We're looking for individuals, especially individuals that have the potential to be put in situations where there may be some type of intoxicating substance. So what we're looking for at this point is individuals on their way to college, high school students. We can educate them on important things like the 911 immunity law, which states that if you call 911 for medical aid, they can't be arrested for things like underage drinking, drugs, and paraphernalia. Also educating people on the dangers of illicit substances, with pretty much everything at this point being laced with fentanyl. Having a Narcan will help. Narcan kit will help. We teach them a little bit about if they are using, maybe they should be using with a partner, an individual that can call 911 if they do suffer that medical emergency, and there's no danger to calling 911. So getting Narcan on the street does save lives, and anybody can use it. They can keep it in their home and treat it like a fire extinguisher. It's there if you need it, and hopefully you never have to use it.
Why is it important to kind of team up with organizations like Carol, kind of go hand in hand?
It brings it to real life. You're talking to a mother that lost her child. So when it brings to real life and realizing how sweet and wonderful Carol is, you know that she's a loving mother, and this is an issue that's near and dear to her heart. It humanizes it, and it shows that this can happen to anybody, regardless of socioeconomic status. This could happen to any individual at any moment. And teaming up with Carol, she brings a huge wind to this issue. She's passionate, and you can't stop her. I complain all the time. Maybe she's Jewish.